Survival from cardiac arrest requires quick recognition, rapid response, early defibrillation, and ACLS intervention. Understanding the operation of your ZOLL M Series before you encounter an emergency situation will enhance your potential to save victims of cardiac arrest. Users should review the first M Series in-service video for basic operation of the M Series for manual defibrillation, advisory function, electrode placement, and proper battery maintenance. This second program will introduce you to the ZOLL M Series with ZOLL's low-energy rectilinear biphasic waveform, AED function, and additional monitoring parameters including pulse oximetry, 12-lead ECG, End-tidal carbon dioxide monitoring, and non-invasive blood pressure. M Series are now available with a choice of 2 defibrillation waveforms. Some M Series are equipped with a monophasic waveform, and some offer ZOLL's new low-energy rectilinear biphasic waveform. The rectilinear biphasic waveform offers superior defibrillation capabilities at lower energy settings. The suggested 3-shock VF protocol for monophasic waveforms is 200, 300, and 360 joules. The suggested biphasic 3-shock VF protocol is 120, 150, and 200 joules. Successive low-energy shocks should remain at 200 joules. Recommended pediatric settings should remain consistent with monophasic joule settings. Users should consult your medical authority to confirm pediatric settings. Biphasic energy levels for internal defibrillation should also remain consistent with monophasic protocol, unless otherwise directed by your medical authority. This video depicts the use of biphasic defibrillators. Other than energy levels, there are no operational differences between biphasic and monophasic M Series devices. The M Series defibrillator monitor is capable of analyzing a patient's ECG to identify if a shockable rhythm exists when using multifunction electrode pads. To use the AED feature, the selector switch must be turned to on. The M Series is capable of analyzing a patient's ECG rhythm in 2 different ways.
Stand clear.
The first is always active in the semi-automatic mode when MFE pads or ECG cable and electrodes are in use. The second is user-activated,
Stand clear.
initiated by pressing the Analyze button. The M Series AED may be configured to automatically analyze on power-up. Also, the M Series may be configured to automatically charge if a shockable rhythm is determined.
Press shock.
Consult your M Series operator's guide for detailed information on ECG analysis and automated external defibrillator operation. To use the AED in the semi-automatic mode, verify the patient is unconscious, not breathing, and pulseless. Request assistance, begin CPR, and remove clothing covering the patient's chest. If not pre-connected, connect the MFE pads to the multifunction cables. Apply the MFE pads according to directions on the package. Pads may be applied in anterior-posterior or apex-sternum positions. Ensure that all MFE pads are making good contact with the patient's skin and are not covering any part of the ECG electrodes. Set the selector switch to on. The unit will beep 4 times to indicate that it has passed the power on self-test. If the audio recorder is present, the unit will begin recording audio data.
Attach pads.
On power-up, the message and voice prompt, "Attach pads," will be issued if ECG electrodes or MFE pads have not been attached to the patient.
Check pads.
If the pads become detached or the connection is broken, a "Check pads" message and voice prompt will be issued. Biphasic M Series defibrillator default settings are shock number 1 at 120 joules, shock 2 at 150 joules, and shock 3 and up set at 200 joules. If your M Series utilizes a monophasic waveform, default settings are 200, 300, and 360 joules. If medical protocols allow, the operator may select any of the pre-configured energy levels using the Energy Select up or down arrow buttons. The new energy level will display on the monitor. Press the Analyze button to begin the analysis of the patient's ECG rhythm.
Stand clear.
A Stand Clear message and voice prompt will be issued. An analyzing ECG message is then displayed while the patient's ECG is analyzed. If MFE pads have not been properly connected to the patient, a Use Pads message will be displayed and analysis will be inhibited. Warn all persons attending the patient to stand clear.
Stand clear.
No one should touch the patient, bed, or any equipment connected to the patient during defibrillation. A severe shock can result. When analysis is complete, the unit indicates whether or not a shock is advised.
Stand clear.
When a non-shockable rhythm is detected, the No Shock Advised message and voice prompt are issued.
No shock advised.
Immediately check the patient's pulse and breathing and resume other treatment per protocol. If the patient's rhythm is shockable, the unit will display a Shock Advised message.
Press shock.
If so configured, the defibrillator will automatically begin charging to the pre-selected energy setting and display a charging message.
Press shock.
When the unit is charged and ready, the shock button will illuminate and the Press Shock message and voice prompt will be issued.
Press shock.
Press and hold the shock button on the front panel until the energy is delivered to the patient. Observe the patient or the ECG response to make certain the shock has been delivered. A continuous tone will sound for 10 seconds, followed by an intermittent beeping for 5 seconds. The shock must be delivered within this 15-second interval, or the defibrillator will disarm itself.
Press analyze. Press shock.
After the shock,
Check pulse.
the display returns to the energy selected and indicates the number of shocks delivered to the patient. Press the Analyze button to restart an ECG analysis and determine if additional shocks are required. If so configured, the M Series will automatically analyze and recharge.
Press shock.
The unit uses both audio and visual prompts to present critical information to operators. Please consult the M Series Operator's Guide for detailed information on voice prompts and operating messages, which can occur during semi-automatic operation. If your device has been custom configured, some information may be different. Press the Manual Mode soft key on the front panel of the unit to enter the manual mode of operation. If the Confirm soft key is not pressed within 5 seconds, the unit will revert to semi-automatic operation. If the M Series has been configured to require an access code, Enter Access Code will be displayed, and the operator will have to enter a 3-digit access code by pressing the soft keys corresponding to the correct digits. If the MFE pads are not making good contact, or if a short circuit between the pads exists, 2 messages, Check Pads and Poor Pad Contact, will be alternately displayed and energy will not be delivered. Please refer to the previous in-service videotape and M Series Operator's Guide under Manual Defibrillation, Advisory Defibrillation, Pacing, and ECG Monitoring sections for the appropriate detailed instructions for operation in the manual mode. M Series defibrillators may be equipped with Masimo's patented set pulse oximetry technology, which offers superior performance during motion, low perfusion, and high ambient light conditions. For detailed instructions on proper sensor size, application, and detailed operating instructions, please please see the pulse oximetry insert in the M Series Operator's Guide. To use the M Series with SpO2, attach the SpO2 cable to the Massimo connector on the rear of the M Series. Plug the sensor into the SpO2 patient cable. The reusable sensor is simply placed over the appropriate site. Attach the sensor to the patient. Choose a site that is well perfused and one that is least likely to restrict patient movements. The ring finger or middle finger of the non-dominant hand is preferred. The disposable sensor should be placed by carefully following the instructions on the package. Turn the M Series selector switch to on if you are using an AED, or to monitor for advisory and manual devices. A dashed line will be displayed in the SpO2 field until a pulse is detected. Once the measurement has been established, the saturation values will be displayed in the numeric window. If ECG leads or pads are not attached, the patient's pulse rate, as measured by the SpO2 sensor, will be displayed as the heart rate in the ECG field. When the parameter soft key is pressed, the select, enter, and return soft keys will be displayed. Pressing the select soft key allows you to scroll through different physiologic parameters if available. Selecting the SpO2 soft key causes the following soft keys to appear: sensitivity, average, alarms, and return. The sensitivity soft key allows the user to select either normal or high sensitivity for SpO2 monitoring. The normal setting is recommended for most patients. The average soft key provides 3 different time periods over which SpO2 values are averaged: 16 seconds, 4 seconds, 8 seconds, which is the default setting. The return soft key returns the operator to the previous screen. If desired, the user can select a plethysmographic waveform by pressing the Wave 2 soft key until the desired waveform is displayed. If the monitor is equipped with End-tidal CO2, the ET-CO2 waveform will be displayed with the first press of the Wave 2 soft key. Pressing the Wave 2 soft key again displays the SpO2 waveform. Press the Alarms soft key to display the Set Alarm screen and corresponding soft keys. This screen allows users to enable or disable alarms. Consult the operator's guide for detailed instructions on alarms, their priorities and limits, and how pulse oximetry operates in AEDs. M Series defibrillators may be equipped with 12-lead ECG capabilities that provide simultaneous acquisition, storage, display, and ECG analysis using the GE Medical Systems 12SL program. Transmission to a fax machine or directly to GE Medical Systems Catalyst Muse is also available. Users should read the detailed instructions found in the M Series 12-lead ECG Monitoring Operator's Guide. The M Series Operator's Guide also gives detailed instructions on entering patient data. To acquire a 12-lead ECG, the one-step patient cable should be inserted into the ECG cable connector in the rear of the M Series. Care should be taken to properly prep the patient's skin. This may include clipping excessive hair and light abrasion of the skin to ensure proper electrode contact. High-quality silver-silver chloride electrodes should be attached to the ECG cable snaps and placed on well-prepped skin. When V-leads are not in use, users must plug the protective cap into the V-lead connector on the one-step patient cable. When V-leads are required, the V-lead connector should be pressed securely into the one-step patient cable. On manual M Series defibrillators, turn the selector switch to monitor. On M Series with AED, the switch should be turned to the on position. If pads or paddles are selected, select one of the leads. When the M Series is equipped with 12-lead capabilities and the selector switch is turned to monitor, The physiological monitoring menu will be displayed with the following soft keys: parameter, wave 2, ID number, alarms, and 12 lead. To rapidly acquire a 12 lead, press and hold the recorder button for 3 seconds. A 4x3 12 lead report without interpretation will be printed. When the 12 lead soft key is pressed, the following screen will be displayed. Pressing the Acquire soft key begins the 12 lead acquisition process. The acquiring ECG message will be displayed, and the Acquire soft key changes to Halt. The 12 lead ECG interpretation and measurements will print if so configured. The Halt soft key can be pressed at any time to abort the 12 lead process. When the Halt soft key is pressed, the acquisition halted message is displayed. If one or more of the V-leads should become detached during the acquisition process, a V-lead lead-off message will be displayed on the screen. When 10 seconds of valid data have been acquired by the device, the message Acquisition Complete will be displayed, and the unit will proceed to the data transmission screen if so configured. Please consult the M Series Operator's Guide for detailed instructions on phone number entry and data transmission. In the event that a 12-lead ECG record fails to transmit, the operator will be notified and the M Series will continue to retry the transmission until either the transmission is successful or the operator aborts the attempt. The Settings soft key allows the user to change the ECG filter, lead group settings, or the dial type for telephone transmission. Selecting the Filter Settings soft key allows the user to select among the following 3 settings for 12-lead monitoring: 0.05 to 150 Hz for monitoring 12 leads in a diagnostic bandwidth, 0.05 to 150 Hz for continuous printout, 0.05 to 40 Hz for monitoring 12 lead when excessive artifact is present. This setting may also be used to acquire a 12-lead ECG under difficult conditions. The M Series with 12-lead option allows 3 ECG lead signals to be simultaneously printed on the multiple application printer when using a 12-lead cable with one of those 3 leads selected. Consult your operator's guide and M Series configuration guide for more information on setting lead groups. Dial type allows the user to select between pulse and tone dialing when connected to a telephone. Press the Alarms soft key to display the Set Alarm screen and corresponding soft keys. This screen allows users to enable or disable alarms. Pressing the Patient Information soft key allows the user to enter pertinent patient data, such as the patient's name and ID number. Pressing the Age soft key allows the user to enter the patient's age. The Gender soft key is used to identify the patient as male or female. The Patient Record soft key allows for reviewing printing or transmission of a previously stored 12-lead recording. Pressing the Return soft key returns the operator to the previous screen. Your M Series may be equipped with a Novometrics End-tidal CO2 monitoring option, which continuously measures carbon dioxide and respiratory rate using a unique mainstream solid-state sensor called a capnostat. Please review the End-tidal CO2 Operator's Guide insert for detailed instruction. Attach the capnostat CO2 sensor cable to the CO2 connector at the rear of the M Series. Turn the selector switch to monitor. Wait for the CO2 sensor to warm up. This will take approximately 60 seconds or less. The message CO2 sensor warm-up will disappear when the capnostat is ready for use. The first time a particular capnostat sensor is connected to the M Series, a 0 CO2 sensor message will be displayed after the sensor is warmed up. This is only required when a capnostat is plugged into an M Series for the first time. The same capnostat may be unplugged and replugged into the same M Series without re-zeroing. Place the sensor on the 0 cell, which is attached to the sensor cable. A zeroing CO2 sensor message will be displayed for about 15 seconds while the sensor is automatically zeroed. The sensor's zero calibration can be checked by placing the sensor on the reference cell. An EtCO2 value of 38 millimeters of mercury, plus or minus 2 millimeters of mercury, should be displayed. Attach the airway adapter to the capnostat. The first time a given adapter type is attached to the capnostat, it must be zeroed. To zero the adapter, press the parameter soft key. Select the EtCO2 menu item, then press Enter. Press the Zero soft key. Select Start using the Zero soft key, then press Enter. Zeroing CO2 adapter will be displayed for about 15 seconds. An airway adapter zero will be required after switching between different airway adapter types, but is not required when switching between the same type of adapters. Multiple color-coded disposable and reusable adapters are available. Consult the operator's guide for assistance in selecting the proper adapter, adapter setup, location in the breathing circuit, and how to clean reusable adapters. The M Series with the End-tidal monitoring option monitors both CO2 and respiration rate. The results are displayed in the CO2 field located on the M Series display. The maximum concentration of CO2 detected during each breath is displayed, along with the number of breaths per minute labeled RR. With the M Series in the monitor mode, the main monitoring menu is displayed with the following soft keys: Parameter, Wave 2, ID number, and Alarms. When the Parameter soft key is pressed, the Select, Enter, and Return soft keys will be displayed. Pressing the Select soft key will scroll through the different available physiological monitoring functions. Pressing the Enter key allows the user to select the parameter that is highlighted. The Return soft key allows the user to return to the physiological monitoring menu. Selecting the EtCO2 parameter causes the following soft keys to appear: Zero, Average, Compensation, Scale, and Return. The Zero soft key allows the user to begin the process of zeroing the adapter. The Average soft key provides 3 different time periods over which the highest EtCO2 values are averaged: 10 seconds, 20 seconds, or 1 breath. The Compensation soft key provides compensation for elevated levels of oxygen, 60% or greater, and for the presence of nitrous oxide, or both. The Scale soft key allows the user to select the scaling on the display of the capnographic waveform. The Return soft key allows the user to return to previous screens. The M Series is capable of displaying a capnographic waveform on the screen and also provides printing capabilities. To display a second waveform, press the Wave 2 soft key. Pressing the Wave 2 soft key will toggle the display between EtCO2 and SpO2. Pressing the ID number soft key allows the user to enter the patient's identification number. If your M Series is equipped with non-invasive blood pressure, you have the ability to measure arterial blood pressure in resting patients. Please consult the NIBP insert in the M Series Operator's Guide for a complete list of operating instructions and cautions. To take a non-invasive blood pressure, connect the hose to the front of the M Series. Place the cuff on the patient's arm. Consult the NIBP insert in the M Series Operator's Guide for a complete list of cautions and advice on proper cuff selection and placement. From the main monitoring menu, press the Parameter soft key to access the Physiologic Monitoring Parameter menu. Press the Enter soft key, and the M Series will display the following: NIBP Stat, NIBP Auto, Cuff Inflation, Auto Interval, and Return. NIBP Stat allows users to take up to 10 readings within 5 minutes. NIBP Auto allows users to take automatic measurements at preset increments. These increments can be set between 120 minutes and 2.5 minutes. The settings can be easily changed by pressing the Auto Interval soft key and pressing the Increase or Decrease soft keys to adjust the settings. Before taking a measurement, check that the initial cuff inflation pressure is appropriate for the patient. The default cuff inflation pressure is 160 millimeters of mercury. To adjust the inflation pressure, press the Cuff Inflation soft key and then press the Increase or Decrease keys. If the auto feature is set to off, the selected cuff inflation pressure is used for all measurements. If the auto feature is set to on, the selected cuff inflation pressure is used for only the first measurement. After the first measurement, the cuff inflation pressure automatically adjusts to 30 millimeters mercury greater than the systolic value of the previous measurement. To take a single measurement, press the NIBP button. The cuff inflation bar reflects the status of the cuff inflation pressure. This cycle takes approximately 30 seconds. The M Series will not start a new measurement unless 30 seconds have elapsed since the end of the previous completed measurement cycle. To take stat measurements, press the NIBP button and hold it for 2 seconds. Or press the NIBP Stat soft key. You can abort the NIBP Stat process by pressing the NIBP button, or by pressing the NIBP Stat soft key for a second time. To take automatic measurements, first select the appropriate interval, then press the NIBP Auto soft key. To stop the process, press the NIBP button. If a systolic pressure cannot be detected, the M Series immediately increases the cuff inflation pressure and completes the measurement. If after 180 seconds the M Series has not been able to determine systolic, diastolic, or mean pressure, it aborts the measurement and deflates the cuff. After each measurement, the NIBP display area displays systolic, diastolic, and mean blood pressure values. If the M Series is unable to detect a measurement due to excessive motion or vibration, an asterisk is displayed and the message Repeat NIBP Measurement will alternate with NIBP Artifact. By pressing the Summary key, then pressing the NIBP History soft key, the NIBP history will be displayed. Pressing the Print soft key will print NIBP, SpO2, and EtCO2 measurements if present. Pressing the Return soft key returns the user to the main menu. Please consult the M Series Operator's Guide for detailed instructions on enabling and disabling alarms and how NIBP operates in the M Series. For additional detailed information on the operation of your M Series, contact your ZOLL representative or ZOLL technical support.